the general population has a 4.6% risk of attempting suicide. Folks who are gay or lesbian have like a 10 to 20% risk of suicide attempt, and trans folks have a 41% suicide attempt rate. You know, being transgender is not a mental illness. However, many trans folks do have mental health issues. One, because some people just have mental health issues, and two, because if you've been suppressing who you are for so many years, or if you've come out with who you are but you're being bullied or not accepted, then having depression and anxiety is sort of a natural thing that follows.
In this episode of In the Shadows, Being Transgender, Dr. Sharon Vermont.
Welcome to In the Shadows, where we shed light on difficult issues right here in our community. I'm Patty Lemons. So far, I've shared 3 stories with you of people who are transgender, and we still have a couple more to come. I hope you've listened with an open mind and that you have a little bit better understanding of what it's like to be transgender. I applaud those who have been brave enough to share their stories so far. If you haven't lived it, I know it can be difficult to understand, so I thought it was important to interview a medical professional and get their perspective on the topic. Joining me today is Dr. Sharon Dunski Vermont, who is a pediatrician at WashU in St. Louis. Sharon has been practicing since the early 1990s, and she's seen the evolution of care provided to those who are transgender. A few years ago, the issue hit pretty close to home for her when her son, who was she at the time, came to her and said he was transgender. Today, Sharon is an advocate for our transgender youth. Thank you so much for being here today, Sharon.
Great. Thanks for having me. I'm happy to be here.
So, Sharon, what does it mean medically to be transgender?
So being transgender means that a person identifies as a gender that is different from the sex that they were assigned at birth. You know, sex is based on genitalia. So the baby's born, the gynecologist looks between the legs, sees a penis, sees a vagina, and says it's a boy, it's a girl. But that is a designation that a doctor gives about a person in a very quick moment in time right after birth. It has nothing to do with how that person feels about themselves. As a child starts to grow, you know, most children maintain the identity that goes along with the sex they were assigned at birth. But somewhere between 1% and 3% of kids start to develop an identity that is different than the gender that people think they are. And so that is what we call transgender.
So can you explain the different types and the terms? We've all heard about kids who are born with both sets of genitalia. How often does that happen? Does that kind of come into play, or are we talking about something completely different?
So when a child is born with the genitalia of both a male and a female, that's actually called intersex. And that is a separate issue. However, a lot of people who are intersex do identify as part of the transgender community because when those kids are born, especially in the past, doctors and parents would be really quick to decide if that child should be raised as a boy or girl based on the genitalia that they had, and if the doctor felt it was easier to perform a surgery to create female or male anatomy. And we know now that doing surgery on those kids at a young age is really not okay, because basing someone's gender on a surgical procedure to create genitalia may end up causing a big mistake, because a lot of those kids then grow up and don't feel like the gender that they were sort of assigned based on their surgery. And so a lot of these folks who are intersex end up transitioning because the decision was made for them incorrectly when they were young.
And how common is that?
So, you know, I don't have good statistics on intersex kids, but, you know, it's not super common, but it's common enough that we definitely see it. And for instance, at Washington University, where I work, there's actually a clinic designated for just seeing kids who are intersex, because those kids have specific medical needs and need to have a whole team of physicians working with them.
So explain then, you talked about gender and how that's different than when a baby is born physically,
the sex that they're assigned at birth.
Okay. So how is that different than gender?
Right. So sex is based on genitalia. Gender is how a person feels about themselves, and it comes from the brain. Most of the time, the way a person feels about their own gender does match their anatomy. But again, somewhere between maybe 0.5% to 1% up to maybe 3% of people, we don't have great numbers, but somewhere between 0.5% and 1% and 3% of people identify as trans. And those are people who, in their brain, at the core of who they are, they fully feel that they are a gender different than what they were assigned at birth. It really comes from their brain and how they feel about themselves. We don't know what causes people to be transgender, although studies have been done that do sort of allude to a genetic or biologic cause, but we don't know specifically what that cause is. Gender identity is pretty much fully solidified in a person's brain somewhere between ages 4 and 6. So, for instance, when I was 4 or 5 years old and I would tell people I was a girl, they weren't surprised because I was assigned female at birth, and it just made sense that I would say I was a girl, so no one questions it. But if a child who was assigned female at birth around 4, 5, 6 years old starts telling people that they are a boy and they feel like a boy, everybody's up in arms and they get all upset. No, you can't be a boy. You're actually a girl. The truth is, just how I knew at 4 or 5 that I was a girl because my brain told me I was and my identity was solidified in my brain by that age, kids who come out as transgender at a really young age, their gender identity is who they are, and it's pretty much solidified by that age. So we need to believe these kids.
So if that happens, what do you do as a parent?
Yeah. So the best thing to do for your child, if they come out and tell you that their gender is different than what you thought it was, is to love your child and support your child. Ask them what name they want to be called. Ask them what pronouns they want used. And do everything you can to make your child feel comfortable with who they are. Because it's scary for anyone, especially a young child, to, sort of share this secret with people that I'm not the gender you thought I was. And so love them and support them and follow their lead, because the kid will tell you what they need and you just sort of need to listen to them and do it. We know from studies that when kids are supported in their transgender identity by their family and the people around them in their lives, that those kids have the same levels of anxiety and depression as the general population. But when kids are not supported by their family and they're not supported by their community and their doctors, their risk of becoming extremely depressed, extremely anxious, and even suicidal is extremely high. The transgender community has a 41% risk of attempting suicide compared to 4.6% in the general population. So we've got to make sure these kids are supported, because supporting them saves lives and helps them have, a healthy, happy life, and make sure that they are not suffering from mental health issues.
So when you're talking about the ages 3, 4, 5 years old, those are the kids who also say they're going to be an astronaut and a zookeeper and the president all at the same time. How do you know?
So I get asked that question all the time. And it's a good question, because if you've never met a trans kid, it's really hard to understand how they know these things. If a child comes to you and says they're a dog, and you tell them, no, you're not a dog, you're really a little boy, they're going to laugh and they're going to walk away and they'll be fine. But if a child comes to you and says, I'm really a boy, and you tell them, no, you're not, they're going to get upset. They're going to become distressed. They're going to become upset. They're going to have some negative emotions coming from this, because you don't believe that they know who they are. And when kids are often told, no, you're not really a boy, no, you're not really a girl, those are the kids that develop depression. They don't develop depression because you tell them they're not a dog, right? And so that tells us that their gender identity, the gender they know themselves to be, really comes from within. It comes from their core. And there was a study done out of Seattle a couple of years ago by a psychologist, and she looked at, I think it was 32 transgender kids between the ages of 5 and 12. And in her study, she found that the gender identity of these trans kids is a very deeply held belief, and that it is not it's not the result of confusion. It's not the result of them not understanding who they are. It is really a deeply held belief that, many of these kids, most of them maintain throughout their life. And so they just need to be supported.
So I heard that there was a study done, and you may or may not know about this, where the actual brain scans of people who are transgender they match the scans of the sex that they become, or the gender they become, sorry.
So yeah, there have been several studies actually that have looked at brain scans, MRIs of transgender folks, and even before these folks were ever treated with any hormones, their brains in many areas looked much more like the brains of the gender that these people know themselves to be than of the brains of other people who were assigned their gender, the same gender they were at birth. So in other words, somebody who is transitioning from female to male, that's a transgender male. Trans male brains look much more like other male brains than female brains. And so that tells us that there is a biologic, possibly genetic component to this. There have also been twin studies, and when they looked at identical twins where one is transgender, and then they looked at non-identical twins where one is transgender, the chances of the other twin also being transgender is much higher among identical twins than among non-identical twins. Again, telling us that there's some genetic component. Now, a lot of people say, well, if it was genetic, then 100% of the identical twins would still be transgender. The truth is that it's much more complicated than that, because there are external factors, there are environmental factors, there could be hormonal factors. Maybe one twin was exposed to a little more or less of one hormone than another. So nothing's going to be 100%, but definitely identical twins are more likely to both be trans than non-identical twins. And again, that tells us this is real. These people are not making this up. They know who they are.
So I read an article about how, or maybe it was something that I saw on a documentary about when a baby is forming in their mother's womb, that there's a surge of hormones. Do you have information on that? Do you have a background there that you can fill us in?
So there are lots of theories that people sort of throw around as to why people are transgender. No one really knows exactly why. But, people have looked at hormones, people have looked at just, other things within the womb environment. The truth is we really don't know. I mean, it would make sense that maybe if someone is exposed to more male hormones in utero, that maybe they're more likely to feel male. Or maybe if they are not exposed to enough male hormones in utero, maybe they're more likely to feel female. But the truth is we don't really have a good answer to that yet. Maybe someday.
Have physicians changed the way that they provide medical care for people who are transgender, especially children?
Absolutely. So, I've been a pediatrician since 1993. That's when I started my residency. When I was in my residency back then, we learned absolutely nothing about what it means to be transgender. I don't even think I'd heard the word back then. And prior to that in medical school, it was never mentioned in any of my studies. Being trained as a pediatrician, I had absolutely no knowledge or training of how to help a trans child. And so in the past, I think when kids would come out as transgender, I think a lot of times pediatricians just didn't know what to do. And so they would sort of dismiss it or tell the parent, just ignore it, it will go away. It was certainly not encouraged in many cases. But nowadays, with so many kids coming out as transgender, and we've had, research on the topic, although there needs to be a lot more research, but there's definitely been research out there. We know that supporting these kids is the best thing for them. And the American Academy of Pediatrics, the American Medical Association, the Endocrine Society, so many medical organizations now say that giving kids gender-affirming care is the best way to go. So what's gender-affirming care? That is care that respects the child's ability to know their gender and know who they are. So nowadays, good physicians, there's certainly always bad physicians out there, but good physicians, encourage parents to take their children who have questions about gender to a therapist to explore the issue. And it needs to be a therapist who has training, dealing with gender, because even some therapists have no idea what to do with these kids. So physicians now know to refer to a gender therapist. They know that allowing a child to dress the way they want and use the name that they want and wear their hair the way they want is the best thing, because then that tells the child that you hear them and that you recognize that they know who they are. And then, as kids get older, we now know that preventing a child's natural puberty can really help in so many ways by preventing trans boys from developing breasts and getting their period, and preventing trans girls from developing deep voices and facial hair. We are helping those kids to align their bodies with their gender, with their minds. And so physicians now, I think, are much more quick to either prescribe medicines to halt puberty or to, send kids to a center that does this sort of gender affirming care. So it's really come a long way from when I started, that physicians now are knowing more and more how to help these kids.
So you touched on this a little bit. I was going to ask you to explain transition. Can any harm come to your child by transitioning too earlier? What if, you don't really know, or you haven't come to terms with it? Is it reversible? And we'll go into some other questions, but does harm come to your child from doing that?
So harm can definitely come to your child from not allowing them to transition. Even young kids could attempt suicide if they are not believed in who they are, if parents don't recognize them for who they are. But I don't really think there's ever a time that harm could come to a child from allowing them to live as their authentic self. The only time it's harmful or dangerous is if you let them be around people who don't accept them, and people who don't believe them, and people who maybe will bully them or make fun of them. But in terms of their own mental health and their own well-being, the best thing you can do for these kids is let them be who they are. And I don't think it's ever too early to let a child transition. You should never force someone to transition. You should never tell a child to transition. But if a child is asking for different clothes, different name, different hair, different pronouns, then supporting them is really the best thing that you can do. I mean, we know this from studies, that their mental health will be better for this. If you let a child cut their hair, use a boy's name, use he, him pronouns, and wear boys' clothes, and then several years later they come to you and say, you know what, maybe this isn't my path after all. Maybe I really am a girl. Let them, go back to using a girl name and girl pronouns and wear girls' clothes. But no harm has come to them because you supported them in the moment that they needed your support. And now you're allowing them to be who they are again and supporting them, sort of undoing all these things. This is what we call social transition with changing name and pronouns and clothes. Social transition is 100% reversible because you're not doing anything medical.
So when you get to puberty age, and you talked about hormone blockers, is that reversible?
So puberty blockers are 100% reversible, which is why I think that they are such a wonderful tool that we have for these kids, because it buys us time without causing any permanent changes. We try to take kids at the very earliest sign that they are going through puberty and block their puberty from that point on. Puberty blockers come in a couple forms. They either can be used as an implant that goes in the arm and stays for a couple of years and then can be changed. After 2 years, you just replace it with a new implant, or a shot that you get every 3 months. Basically, these medicines cause the brain to stop telling the ovaries or testes to produce estrogen or testosterone. So by preventing their bodies from making these sex hormones, you sort of stop puberty right in its spot, right in its place, and you give kids a couple of years to really figure out who they are. There will be a small percentage of kids that will, after some time, say, you know what, maybe this isn't really my path. Then you just either take out the implant or stop giving them the shot. Their natural puberty will resume, and it will be as though nothing happened. There's no permanent effects, no lasting effects, and no negative side effects. If, however, which happens in most cases, the child eventually says, yeah, like I really am a boy or I really am a girl, then at the appropriate time, following international guidelines and making sure that we are very careful and methodical about when to do this, we can start gender-affirming hormones, either estrogen or testosterone. Now, those cause permanent changes and are not reversible, which is why we are extremely careful and thoughtful before we provide them. At the center where I work, we always require that kids get a letter from a mental health provider who has experience working with transgender kids before we start the gender-affirming hormones, because that tells us that the therapist has explored all of the important issues with these children to make sure that they really know who they are and that they're really in the right place to, start a medical transition.
Is that part of the medical transition, or then are we taking the steps for surgery after that? Can you kind of go into that a little bit?
Right. So not every trans person wants to do the same thing for transitioning. Some people are happy with just having a social transition. There are even some adults who don't mind that, yes, I identify as male, but I still have breasts, or yes, I identify as female, but I still have, coarse skin and facial hair. Some people really don't mind that they have physical characteristics of the gender that they were assigned at birth. Many transgender people want a hormonal transition. And so we offer it if that is what they need. We never require it because, there's no one right way to transition. It's very personal to each individual. And with surgery, it's the same thing. I see a lot of trans folks who do want gender-affirming surgeries, but I definitely see a number who say, you know what, I'm happy with my body. I don't want to be cut on. I don't need to have different genitals. I know who I am, and hormones for me are enough. Surgery, again, though, if somebody's going to undergo that, it's done very thoughtfully. It's done following international guidelines at an appropriate age and an appropriate time. And so nothing with a medical or surgical transition is done just sort of, on the fly. Everything follows standards of care that have been thoughtfully put together by experts from all over the world. And any good doctor will follow these standards of care because we don't want to cause harm. We don't want to jump into anything too quickly, but yet we want to support the patient.
Great. So if you have a transgender child, you see a pediatrician, therapist, what other specialties?
So trans kids can see, as little as just a pediatrician, because there are some pediatricians out there who from their general pediatric office can and do prescribe gender-affirming hormones. But more commonly, these kids will go to either a pediatric endocrinologist or just a big center for that, a transgender or gender center. I'm usually at a big medical center. So for instance, I work at the Washington University Transgender Center at St. Louis Children's Hospital. And in our center, we have a pediatric endocrinologist, we have an adolescent medicine physician, I'm a general pediatrician, and all three of us can prescribe hormones. We also have a psychiatrist and a therapist. Being transgender is not a mental illness. However, many trans folks do have mental health issues. One, because some people just have mental health issues. And two, because if you've been suppressing who you are for so many years, or if you've come out with who you are, but you're being bullied or not accepted, then having depression and anxiety is sort of a natural thing that follows. So, we recommend that when kids are having mental health issues, that they definitely get help from a psychiatrist or a therapist. Some of these kids will see surgeons. Some trans females will see a dermatologist to do either laser hair removal or electrolysis. There's a whole host of specialties, and also trans men. So those folks who have transitioned from female to male may need to see a gynecologist because some trans men choose to leave their uterus in place, and so they need pap smears. If they do not have their breasts removed, they still need breast exams and mammograms. Trans women, may need to see a urologist because even if they do have surgery to create a vagina, their prostate gland is never removed. And so as they get older, they could still have prostate issues even though they look female. So there are a whole host of specialties that can be involved with the care of trans folks. The thing is that there are doctors out there who are not very familiar with trans care. And so I do a lot of speaking among medical professionals to try to spread information so that doctors understand what care their trans patients need. Because if you see adults and you're not aware that trans women still have a prostate, you might miss prostate cancer. Or if you don't know that your trans male patient still has a uterus, you might miss cervical cancer. So it's really important that doctors understand that trans folks may need care that's a little bit different than other patients.
I drove to St. Louis to interview you because you're a great resource for this. A lot of our listeners are going to be from Southwest Missouri. Do we have resources down there that you would recommend?
In Southwest Missouri, there are not, unfortunately, a lot of resources. There are a few therapists in Southwest Missouri that will see trans kids, but they're few and far between. So at the Transgender Center where I work, we see kids, teens, and young adults up until they turn 26 years old. We see new patients up until they're 21. And many of these patients come from Southwest Missouri, really from all over the state. We even have patients from, surrounding states like, Kansas and Illinois and Arkansas, Tennessee. Unfortunately, when you get into more rural areas and smaller towns, there are not as many resources. But again, there are a few therapists in Southwest Missouri. I know at one point there was a pediatric endocrinologist sort of in that area that was prescribing some hormones for kids, but I believe that has since stopped. So it is unfortunate. A lot of our patients have to drive several hours to see us. And, I just hope that in the near future there will become more and more resources in more and more areas because, when you're transgender, it's hard enough to sort of figure out what kind of care you need. And then to realize that you might have to drive 2, 3, 4 hours to get that care makes it even more difficult. And a lot of times this care is not even covered by insurance. And so trans folks just have so many struggles and so many barriers to care. And so hopefully, as time goes on, sooner rather than later, there will become more resources in more places.
Since we're talking about the resources, are there resources available outside of medical care? Are there support groups? Are there online groups for people in Southwest Missouri or anywhere in the world?
So there are a lot of resources all over the world. I know that in Springfield, Missouri, there is an active PFLAG chapter. So PFLAG, it's PFLAG. It stands for Parents and Friends of Lesbian and Gay, which is sort of an outdated term, so people just use PFLAG now. And there's no mention within the term PFLAG of transgender folks. However, most of the people that go to PFLAG meetings nowadays tend to be family members with a trans loved one. There are still some people that go to the PFLAG support groups who have, a son or daughter who's lesbian or gay, but more and more PFLAG is helping families with trans kids. And so I know Springfield has that. In St. Louis, we're really fortunate. We have a PFLAG chapter. We have Transparent, which is an organization that I am so passionate about and I am on the board of. Transparent was founded, I believe, 7 years ago by Kim Hutton, who is a St. Louis woman who was looking for resources for her family as her child transitioned to male. And she couldn't find any resources, so she started Transparent, and it is a support group for parents. Now there are also groups for younger kids and teenagers that meet at the same time as the parent group. And these meetings occur at a couple different locations throughout the metro area of St. Louis. There are some additional support groups that are, just sort of throughout the area, as well as many therapists in St. Louis. There are definitely more and more pediatricians in St. Louis that are becoming much more trans competent in terms of their knowledge and understanding what care these patients need. And then, when you look sort of to the world in general, there's an organization called WPATH, the World Professional Association for Transgender Health. And WPATH creates the standards of care that physicians follow when treating trans folks. The Endocrine Society also creates separate standards of care, which are very similar. And WPATH has conferences all over the U.S. and all over the world to train therapists and physicians on how to appropriately treat these patients.
As you can imagine, as this topic has evolved and you've learned more, there are a lot of people out there who say being transgender just isn't a thing. What is your perspective on that, and what have you learned?
I understand why people might think that. And I might have felt this way in the past. It's hard to really remember what I thought 5 or 10 years ago, other than the fact that I didn't know much about what it meant to be transgender. But about 5 years ago, my child, who was 15 at the time and was assigned female at birth, came to my husband and me and told us that he was actually our son and not our daughter. And we were surprised, although maybe not completely shocked. He had been suffering, really suffering, since he was probably about 2 years old with depression and anxiety. And as he got older, a lot of suicidal thoughts. And he had been hospitalized multiple times for suicidal ideations and for just really major severe depression. And when my son finally came out to us, all of a sudden he wasn't so sad anymore. And as he progressed through his transition and started wearing, boys' clothes, and as he changed his name, and as we got his name and gender legally changed, and as he started hormones, and as people started recognizing him as male, his depression went to almost zero. And seeing how happy he was being recognized by the world around him for who he knew himself to be was really incredible. And I started thinking, I was assigned female at birth, and I feel very female. I'm very, very girly. If I went through life with people calling me sir, or telling me I was going into the wrong bathroom every time I went to the women's room, I don't think I'd want to leave my house, because I would be so depressed and not understand, how can you not see that I'm female? And it was the same for my son. He didn't understand why people thought he was a girl, because in his brain he knew he wasn't. And seeing how he just blossomed once he was able to be himself, that really taught me that this is real. Because like I said, I'm very girly. I'm always getting my nails done, getting pedicures, buying dresses, getting my hair done. And I wanted that for my son, because I thought, I enjoy these things. I enjoy shopping. He will too. Back when I thought he was my daughter. And every time I would take him shopping, I would find him in the dressing room crying. And I would say, but this dress is so cute. It looks so good on you. And he would cry, and we'd leave and buy nothing. And I didn't understand it. But when he tried on his very first suit, I believe it was, suit or tux, one of those, for a school dance, the very first time he went to a school dance as male. And I saw him look in the mirror at the store, and he said, oh my gosh, I love this. We've got to buy this right now. And that was the first time I'd ever been shopping with my child, when he was excited to buy clothes. And when he went to the dance a few weeks later, he was all dressed up in his brand new suit or tux, whichever it was. And he looked in the mirror, and he had this huge smile on his face, and he said, wow, I look great. And that was the first time I'd ever seen that. I had tried really hard to make my kid really girly, and he rebelled and cried, and it was horrible. And when he was allowed to just be himself, he was finally happy. It probably took that for me to really understand this, but I promise you that people know who they are. People know their gender. And for people out there saying, well, your son must be mentally ill, he just needs to go to a doctor, he's been to many, and he's been treated for depression. But we know that if you try to get someone to accept a gender identity that everyone else thinks they should be, rather than just accept the gender identity that they know themselves to be, we cause harm. If a doctor tried to get him to accept a feminine identity, he'd be dead by now. But as soon as he was able to openly accept his male identity, he blossomed. So it's real, and studies prove it's real. I've lived it with my child. It's real. So I would encourage anybody who's sitting here listening to me saying that I'm crazy or my son is crazy to do some research, meet a trans person, talk to them, hear their stories, and then you'll have no reason to not believe anymore.
How old is your son now?
So my son will be 20 in just a couple of months, and he is going to college. He's making plans for the future. He's doing great, and he's a pretty cute young man, if I do say so myself. We are lucky that he still wants to live at home with us. I adore my child. I have a daughter also who's 17. I adore her, just as much as I adore my son. My kids love each other. My daughter is very supportive of her older brother and very protective of him. It's a change for the whole family when somebody comes out as transgender. We all had to make adjustments. We all had to go, meet with some therapists who could better explain this whole transgender phenomenon to us so that we understood. But once we all really understood what our child was going through, and when my daughter understood what her sibling was going through, you can't help but just want to support that person that you love so much. And, I hear so much about families kicking their kids out when they come out as gay or they come out as trans. And the truth is, you're a terrible parent if you don't love your kid unconditionally. There is not one thing my kid could do that would make me ever disown really either of my kids. If you kick your child out because of who they are, you should never have had kids in the first place. I love my kids unconditionally. And, my son knows that he's loved and accepted. And so gender isn't really even an issue for us in our house anymore, other than once a week I have to remind him to take his shot of testosterone if he forgets. Otherwise, we don't even talk about gender. I just mentioned that people kick their kids out if they're gay or trans. And I do want to make a point that being gay is about your sexuality. So it's who you love. Being trans is about your gender. So it's who you are. So they are two totally separate things. And yet our gender and our sexuality certainly do go hand in hand and interact with each other. But you can be transgender and be heterosexual. You can be transgender and be gay or be bisexual. What your gender is really doesn't determine your sexuality. They're very separate. And I just want people to understand that, because a lot of times people will say, oh, they're gay, when they really mean that someone is transgender. And I think a lot of people just don't understand the difference. So there is a big difference, but they do go hand in hand.
As far as gender, do you feel like we're all, and I've asked this to other guests as well, are we all on a spectrum? Explain that a little bit.
For sure we're all on a spectrum. I mean, we talk about the gender binary, so there's male on one end and female on the other. And, a lot of people, especially in our society, say, well, that's all there is, male and female. But that's definitely not all there is. Many cultures, have recognized for hundreds or thousands of years that we're all on a spectrum. And, you see it on a day-to-day basis. I mean, when I go shopping, for instance, I will see other people who I assume are female because they look that way to me. I know never to make an assumption, but people that look female who are buying fancy dresses. And then I see other people who are female who are buying T-shirts and sweatshirts, and other people who are, apparently female who are buying, other sorts of clothes. And so, I'm someone who is female and dresses up all the time and wears a lot of fancy things. There are people that I've worked with who identify as female and all they wear are jeans and T-shirts. That doesn't make them any less female and me any more female. It just means that our femininity is expressed differently. And so we're all sort of on a spectrum of how we, show our gender to the world. That's sort of our gender expression, the way we express our gender. I'm not very athletic. I have female friends who would rather be running than, anything else. They'd much rather run than get their nails done. We're both feminine. So we're all on a spectrum. And I wish that human beings would just recognize that we just should accept everybody for where they are and who they are. It doesn't make us any better or worse or any more or less of a human, for how our gender is expressed. And, even a lot of females will say, well, sometimes I feel, more masculine. I grew up as a tomboy, that doesn't make them any less feminine if that's how they identify.
Well, and to clarify on that, you're talking about gender expression. So we're not, you said that you like to do your nails. I haven't done my nails in years. You're not saying that you have more female hormones than I do. You're saying it's an expression.
Absolutely. And I guess, the other thing I should say is that there are people who truly feel within their brains that they are neither male or female, or they're a little bit of both. And that doesn't mean that they have more or less of one type of hormone or another either. It's their own identity. There are people that consider themselves to be non-binary, meaning they're not on the binary. They're not male or female. They're somewhere in between. And these folks often use the pronouns they or them as opposed to he or she. And there are actually, if you look up gender neutral pronouns, there's probably hundreds out there, many that I don't even know or haven't ever seen used. But sometimes people sort of come up with pronouns that they feel fit themselves. And the most important thing is just to use the pronouns that someone wants. If you want to respect someone, respect them by using the name and pronouns that they want. And for people who feel that they're not male or female, they're somewhere in between, that is just as valid and just as real of an identity as me, saying that I have a female identity. We shouldn't judge other people's identities. We shouldn't judge who other people believe themselves to be. We just have to realize that everyone feels differently about themselves, and we should accept that and respect that.
So do you think having the medical background that you have, was your acceptance and understanding of your son a little easier? Did you go to counseling to learn more about it, or was your personal journey, do you feel like maybe was a little easier than other people, or was it tough for you too?
It was definitely tough. I think that having a medical background, as I learned more about what it meant to be transgender and learned more about the different ways in which people transition, I think it was easier for me to understand and accept that, because as a physician, I've, had to use hormones with patients before. I've had patients who are male, but their bodies don't make enough testosterone. And so I have some of those patients who get testosterone shots. I use birth control pills in some patients for various reasons. And so I've used, estrogen because that's in birth control pills. So I think I was able to understand it a little bit better, but it was still very difficult because not that I wasn't accepting. Like I said, I accept my kid for who he is and I will love him no matter what. But for 15 years, I sort of had this vision of what my child's life was going to look like. And it often involved a long white wedding dress and a veil and walking down the aisle with long curly hair. And that was just something I sort of saw in my child's future. And then all of a sudden I realized, okay, that's my dream for my child. That is definitely not his dream for himself. And I had to remind myself that my son's journey is about him. And it's about his vision of his future, not my vision of his future. So I had to learn to let go. And my husband and I did meet with a gender therapist on a few visits just to understand things a little better. Because like I said, I had no background with this. When I was in residency and medical school, the word transgender wasn't even mentioned. But it really only took me a couple of weeks to sort of get through this and understand that this is who my child was. For some parents, though, it takes them years. I've talked with patients whose kids have transitioned 6 months or a year and a half ago, and they're still grieving the loss of their daughter or loss of their son. And, there's just not one right way to grieve, right? Like if you, God forbid, become a widow and you're mourning the loss of your spouse, it may take you years, whereas somebody else may be able to work through that in 6 months. There's no right way to grieve. So it's different for everybody. For me, I was able to get through it pretty quickly. And the conclusion that I sort of came to was, if I can help my child through this, then with my medical background, I can help his whole community. And I recognized very quickly that there was not a lot of medical expertise out there at the time for trans youth in St. Louis and really all over the world. We're lucky because resources have definitely increased in the past 5 years. And so I quickly went to work on getting myself trained and knowledgeable so that I could then help other trans kids, just like some doctors and therapists had helped my son.
Tell me about the suicide rates with kids who are not allowed to be who they need to be.
It's really terrible. The general population has a 4.6% risk of attempting suicide. Folks who are gay or lesbian have like a 10 to 20% risk of suicide attempt. And trans folks have a 41% suicide attempt rate. It's probably because so many kids are not accepted by their family members, by their schools, by their doctors, by their communities. And when you're not accepted, sometimes you feel that you have really no hope. And so it seems like the only option is suicide, which, we know is not the case. Trans folks can live really happy, healthy, successful lives as long as they're given appropriate resources and they're supported. There are trans folks in all socioeconomic classes, in all, sort of areas of the country, rural and urban and suburban. There are trans folks in all sorts of, professional fields. I mean, I know trans people who are doctors, lawyers, teachers, accountants, trans people who work at Starbucks, trans people who work, as truck drivers. So trans people can do anything they want as long as they're given the opportunity. And the problem is that in our country, gender identity is not a protected class. And so in some states it is, but in most states it's not, and federally it's not. So for instance, in Missouri, where I am, you can be fired for being transgender. You can be evicted for being transgender. You can be forced out of a private school for being transgender. You can lose so many pieces of your life all because you're living your truth. So it makes sense why so many of these people feel so desperate that they just resort to suicide. But again, the studies show that when these folks are supported, they do well. Their depression decreases, their suicide risk decreases. I saw a study recently done by a professor at the University of Texas at Austin that showed that when people use a trans youth's preferred name and pronouns, their rates of depression and their rates of suicide attempts drastically decrease. I mean, that's so easy. Just use the name and pronoun someone wants and they become happier. I mean, that's not hard. Which is why we need to get schools on board and we need to get doctors on board, and we just need to get so many pieces of our communities on board with understanding that trans people are just people that just need support. The homeless population in our country is filled, unfortunately, with transgender folks, and many of them are transgender youth. I believe the statistic I saw recently was that approximately 40% of homeless youth in the United States are either lesbian, gay, bisexual, or trans. And it's because these kids are kicked out and they have nowhere to go. So then they end up on the streets. And when you're on the streets, how do you support yourself? Well, you sell drugs or you sell your body. So many of these kids resort to sex work. And that's not what we want for our kids. When you're resorting to drugs and sex work, then you're at high risk for HIV and other sexually transmitted diseases. So how can you live a good life when you're at high risk for dying, either by being killed by a pimp, killed by somebody that's hiring you for sex work, dying of HIV, dying of other diseases, or dying from just being out on the streets and it's -5 degrees and you freeze to death. If parents would just love and support their kids, we wouldn't necessarily be having this discussion. So my biggest hope, my biggest thing that I want people to take away from hearing me speak today is that if you can just love your kid, no matter who they are, and accept them, no matter who they are, even if you need help, even if you need to go to a therapist or a doctor or a support group to get to the point where you can support your kid, do it, because what parent wants their child on the street dead? Not me, and really not many. So we got to support these kids.
Since starting this podcast, I've learned that some of the attitudes that are all around me, whether it's online, whether it's at work, whether it's with my family or my neighbors, I've been a little bit shocked by some of the attitudes. What do you say, first and foremost, to the people who are transgender on how to deal with that? And then in turn, what do you say to those people who are being hurtful, whether they have religious reasons or whether they just don't understand? Can you kind of help me with that?
Sure. So first of all, I tell trans folks, if you're reading an article about transgender issues, never read the comments, because the comments tend to be overwhelmingly hurtful. I have written a couple pieces that were very visible online and made the mistake of reading some of the comments that were written in response to the pieces I had written. And these comments were horrible. I had to just stop reading them because it was awful. Just the horrific things that people would say. And so I tell trans people, don't read the comments. I tell them, if you're being bullied in school, if you're being harassed by someone, you need to talk to somebody who is supportive of you so that they can help you navigate the situation, because this is bigger than so many of these kids. And so they need help. You know, these kids don't often know how to deal with the bullying and the hate that they might receive. And so you need to talk to a trusted adult. Or if you are a trans adult, find a friend who supports you and have them help you navigate the situation. For the people that are being hurtful, why? I mean, why do some people find that they need to be so cruel just because of how somebody else was born? I understand that there are people who believe religiously that being transgender is wrong. And I'm not going to try to change your religious beliefs. I have my own religious beliefs and you have yours. But what I will say is that all of the major religions basically follow the golden rule of, treat others as you would want to be treated, do unto others as you would have them do unto you, love thy neighbor as thyself. If you're being so cruel, you're not following the basic belief of all major religions, which is love and respect every human being. You don't have to agree with someone, but you don't need to be cruel. I see people telling trans folks online, you should just go kill yourself. You're an abomination. Or you're mentally ill, you're crazy, your parents raised you wrong, you didn't have enough of a father figure or mother figure around. First of all, these people are talking out of the air, right? The people that are being so cruel, they're not reading the facts. They're not reading the research. They're not talking to people who have lived, this life of being trans and not being able to admit who they were. Just be kind. Keep your opinions to yourself, because you may not agree with somebody else, but you don't need to hurt them, and learn. A lot of why people are so full of hate is lack of understanding. And so if you would just meet these people and get to know trans folks as human beings, I think it would be so much easier to accept them. And the truth is, probably almost everyone listening to this podcast has met a trans person and they may not have known. I know that I have met people that I had no idea, were transgender, and later found out that they were, and it didn't affect the way I felt about them. I knew them as people. And so if you get to know someone as a person, it's hard to hate them.
Do you have any advice for me as I continue with this series?
So first of all, I want to commend you on doing this series, because, getting the word out there for people to really understand what it means to be transgender, hopefully you're breaking down barriers. And even if you can help one person to be kinder, or one person to accept themselves for who they are and come out and live their truth, if you can help one person, that person can go on to help others. And so it's a chain reaction. So you're doing really, really good work. I would suggest just keep allowing people to share their stories. Because the more that we get these stories out there, the more that people hopefully will start softening their hearts.
Sharon, thank you so much for talking with me today. I am blown away by the comments that you gave me. I hadn't no idea when I came in that you yourself had a son who is transgender. I can see the love you have for him. I know you're probably a great pediatrician and a great advocate for this group of people. So thanks for being here.
Thank you so much for having me. I really appreciate you giving me the opportunity to help spread information, and I hope it changes some hearts. Really do.